Hi, I'm Dr. Joni. Let's talk. Today, let's talk about how to respond when your child's teacher mentions that he or she is concerned that your child may have ADHD. Now, you do realize that teachers in school they're pretty savvy because they are not supposed to say anything to you um, with regard to a diagnosis. You know, if your child is not doing well or if their grades are starting to fall, they can say, yeah, I'm having some concerns, Johnny's not paying attention in school, or, I've noticed that his or her grades have fallen a little bit. But they can be a lot savvier than that, and they'll give you a clue as to what they really think is going on. So teachers will say things like, I have a son who seems to be just like your son. My son has ADHD. Or they'll say, last year I had so many ADHD kids in my class, and your son seems just like them. Just little subtle things that get you thinking when you leave that, does that teacher think my child has ADHD? So the question becomes that I hear a lot is, the teacher thinks my child has ADHD, should I have them evaluated? And more importantly, why is the teacher saying this to you in the first place? So the big question that goes to most parents is, should I put my child on medication for ADHD? Now, here's what I'll tell you. It kind of annoys me just a little bit that teachers will mention ADHD at all. And I know they're trying to be helpful and they're trying to give you some insight. But what I've noticed for a lot of our parents is one of two things will happen. Either one, 100% of the time, they're going to go to Google and they're going to Google ADHD. And for whatever reason, Google is everybody's friend and it gives people some sense of reassurance. Either they can look at Google and not see any of the symptoms in their mind that are consistent with their child, so they can be relieved that, oh no, my child doesn't have ADHD. Or they go to Google and they say, oh my gosh, she does this, she does this, she does this, she does that. I think my child may have ADHD. And so then once they come to this realization, the question then becomes, but if I take them to the doctor, they're going to put them on that medication that I don't want them to be on, that really scares me. So maybe I'll just hold on to this information that my child has ADHD and try to do other things about it. So the question that I get often is, should I have my child evaluated because I'm really scared of that medication? Here's what I'm going to tell you. Do not fear the medication. And under another, Let's Talk, we talk specifically about the truth and the myths regarding ADHD medication. And the bottom line is, if your child had asthma, would you not give them an inhaler? That's a scary medicine for a lot of people, but that it's the inhaler that's going to allow them to breathe again when they lose their breath. If your child has diabetes and their sugar goes up, would you not give them insulin to get those sugars down? Diabetes, if their sugar goes up, they can go into a coma and things like that. Well, if your child has ADHD and can't focus and can't pay attention and can't learn, why would you not consider using medication? And I know for a lot of you, it's just not something you want to do. The medication is scary. And we've talked about that under the medication question as to what that fear is about. But here's what I'll tell you. It is your job, it is your obligation, it is your desire as a parent to do whatever it takes to help your child. And the reality is, if you don't know what's going on with your child, how are you really going to help them? I mean, Google is great, WebMD is great, but the reality is I went to medical school for I don't even know how many years, including residency, for a reason. And that is to learn all that I can know beyond Google about some of these medical conditions. So to answer the question of, should you have your child evaluated after your teacher makes mention about whatever may be going on in class, a resounding yes. Do not hesitate. There's no assurances that ADHD is even what's going on. There's a great possibility, but that may not be the case. But even so, you make the decision as to whether your child is on medication or not. You, period, not the doctor, not the psychologist, not the school. But you need to know what is going on so that you can make an informed decision. So yes, absolutely, have them evaluated. If you don't know where to start, always start with your child's pediatrician, and they should be able to direct you on the right path. Again, if you have more questions that I didn't answer today, don't hesitate to go to the comments section, not comments, but the contact us section, and send another question, and I'll be happy to answer that next month. Take care. We'll talk again shortly.